I'm sorry, those were our last doses.
I think we found the weapon we need to end this crisis. It's vaccines.
We want to streamline the process and make sure all doses are used.
Hello and welcome to a new edition. I'm Nadia Sharbi, and this week we're putting the focus on the French government's vaccination strategy as it comes under criticism for a sluggish rollout. You find us today inside the 104, usually a bustling museum and art centre, now converted into the largest of Paris's 24 inoculation hubs. Here, every day, up to 1,000 people can be given a jab free of charge. That is when the necessary doses are made available. So how close are we to reaching the government's targets? Well, let's start with an overview of this national immunisation campaign as it currently stands.
At the start of the year, they were the first to be vaccinated. Elderly people living in nursing homes, those aged 75 and over, people with serious medical conditions and healthcare providers. By the end of March, the rollout was extended to people aged 70 and over, and since April 12th to all of those aged 55 and over. May 10th for all over 50s. First in line, those with an existing medical condition. Two types of vaccine are currently available here in France. Firstly, those that use messenger RNA. Pfizer-BioNTech and Moderna's drugs both belong to this family. Their vaccines use the genetic makeup of the coronavirus to trigger an immune response and the creation of antibodies. Meanwhile, the AstraZeneca and Janssen vaccines use viral vector technology. The jab sends a modified and harmless version of the virus into cells to spark an immune response. While the bulk of the country's vaccine supply has been imported, in April, doses of Pfizer's drug were being packaged on French soil for the very first time.
Hello, Doctor. Thank you very much for being with us.
Hello.
Now, given that France is currently going through a third wave of the epidemic, is the country's vaccination strategy up to the task?
I think we now have the people and the places to vaccinate. So we can speed up the vaccine campaign to fulfill our goals. That is, as long as there are enough supplies.
And even ahead of getting the vaccine on the market, one of the challenges for the government was getting the French to accept inoculation. France is Europe's most vaccine-averse nation. Has that factor been even more exacerbated by the fact that we've seen issues around side effects, most notably around AstraZeneca?
What we've seen is that when the situation is dangerous, when the threat is real, then people do want to get vaccinated, especially those who are most at risk. Those over 65, for example, they want to get the vaccine. The side effects of AstraZeneca should not prevent people from getting protection from COVID.
And so how are side effects actually tracked? And what happens to those who had a first jab of AstraZeneca and were scheduled to have a second?
When it comes to side effects, it is compulsory for medical staff administering vaccines to declare any unexpected effects that haven't been observed before, or severe reactions that could threaten a patient's life or lead to hospitalization. As for AstraZeneca, those under 55 will have a second dose of a messenger RNA type of vaccine.
And even health professionals sometimes are reluctant to get the vaccine. Why?
Indeed, I think for the regular flu vaccine, some medical staff haven't entirely understood the need to get vaccinated. Today, what is reassuring is that more and more medical staff understand that to protect themselves, their families and patients, they need to get the vaccine. So the number of vaccinated people has risen to 60%.
And beyond the different laboratories and brands, there are different types of vaccine. That sometimes sparks confusion. Why is it important to have these different types of technology?
It was very important to be able to rely on several technologies, because it was perfectly plausible that some of them would not get a final validation, or that some would be more effective or have fewer side effects. And that has been the case. This means that today we can use the different types of vaccine for different strategies. For example, we now know that messenger RNA vaccines help reduce transmission rates best and will be particularly useful in achieving herd immunity.
Now, going forward, the question will also be how these vaccines respond to the different variants of the virus, and therefore how they'll stand the test of time. Can we expect regular, maybe even annual inoculation campaigns in the years to come?
Yes, that's very important. The other issue is how long we will be protected. Even if the vaccines are very efficient and keep that efficiency against the variants, it will be necessary to make sure these vaccines evolve so they protect for longer and adapt to the new variants over time.
Avec une efficacité optimale sur les nouveaux variants.
And the race for the vaccine is basically over. Can France still come up with its own technology? Does it need to?
In the long run, yes. French vaccines could be created, and probably with messenger RNA technology.
Given all this, do you see light at the end of the tunnel? Are you optimistic?
Yes, because we have found a way to fight back through vaccination. And we can be confident in our ability to control the epidemic.
Anne-Claude Crémieux, thank you very much.
Merci à vous.
Well, as the crisis drags on and access to vaccines remains limited, the French public's initial reluctance has been replaced by a steady rise in demand for inoculation. So for those who are now willing but not able to get the jab, the hunt is on for any leftover doses, with a combination of patience and new apps proving to be a winning formula.
This vaccination site in Paris has just finished the day's appointments, but there's still some vaccine left over. The manager comes outside to offer it to those waiting. They're hoping to grab one of the last doses. Older people get priority.
Avec un peu de morbidité quand même, cancer du sein. Bon, eh ben c'est madame, 59 ans. Voilà. Je suis désolée, voilà, c'était les dernières doses.
A queue has formed outside this vaccination site in Marseille as well.
We're going to try the waiting list.
Locals have come by to try their luck.
I'm 20 years old. I'm a student in Marseille. I live close by and thought, there's the centre. If there are some doses left over, I can get it done now rather than waiting until June.
Every day there are no-shows, sometimes because people have made appointments at several vaccination sites, sometimes because they're in hospital or they've simply forgotten about their slot. Once organisers have gone through the waiting list, the vaccine can be given out to people who aren't on the priority list. That's the aim of Covid-List, a website created by volunteers that lets people know when there's a dose going spare nearby. But it's been a victim of its success. Of the 118,000 people who have signed up, only 8,000 were able to get their first dose. Vaccination sites often have their own waiting lists and organise vaccinations so there aren't any extra doses that need to be used up at the end of the day.
Sometimes we won't open a new vial because there's only one person left to vaccinate. We won't open it just for them, so we ask them to come back the next day, which generally they agree to do. We try to manage it like a good household. You have your stocks, you don't want to waste any because it's too precious. For me, there's always a way to vaccinate someone. Or if there's no solution because there's no one on the waiting list, we'll wait until the following day so that we don't waste a vial.
Any age group can take the Pfizer vaccine, and it's the most popular. But that's not the case with other vaccines. After the AstraZeneca vaccine was temporarily suspended in France, some people refuse it. This pharmacist says that when he started vaccinating his patients, he didn't waste any doses. But now he's struggling to find people willing to be vaccinated with AstraZeneca.
Over the past week or so, the number of people over 55 years old who want to get vaccinated with the AstraZeneca vaccine has plunged. There's almost no one on the waiting list. We're going to receive vaccines, but we won't have anyone to vaccinate.
According to France's health ministry, around 25% of AstraZeneca vaccine doses are wasted, against only 7% for Pfizer.
And with that, we leave this edition. Thank you for watching. Stay tuned and stay safe.